Have you ever experienced a sudden, intense redness on your skin, where it feels like your body is on fire, and nothing seems to help? Or maybe you've heard someone mention how their psoriasis has spiraled out of control, spreading to every inch of their body. Well, today, we're diving deep into one of the most severe and life-threatening forms of psoriasis, erythrodermic psoriasis. What is erythrodermic psoriasis? Erythrodermic psoriasis isn't your everyday rash. It's an aggressive, often terrifying, condition where the skin doesn't just flake, it sheds in large sheets. Imagine your entire body covered in burnt-looking, peeling skin, accompanied by unbearable itching, severe pain, and the constant fear of something much worse going wrong inside your body. That's erythrodermic psoriasis. It affects up to 90% of your skin, turning your protective outer layer into something unrecognizable. Now, if that sounds alarming, that's because it is. Erythrodermic psoriasis isn't just uncomfortable, it's potentially deadly. The inflammation and damage it causes can leave you vulnerable to severe infections like pneumonia or even life-threatening conditions like sepsis. And while it may be rare, affecting only 1.5-2.25% of all psoriasis patients, those who develop it need immediate medical attention. But what causes it? Here's where things get tricky. Doctors and scientists don't fully understand why erythrodermic psoriasis develops. Psoriasis itself, which affects millions of people worldwide, is thought to be the result of an overactive immune system. Instead of protecting your body, your immune system goes rogue, sending white blood cells, called T cells, to attack healthy skin. This causes the body to produce new skin cells at an accelerated rate, leading to the characteristic plaques and scaling seen in regular psoriasis. But erythrodermic psoriasis, that's a whole different beast. It's not just your typical flare-up. It can emerge during a flare of plaque psoriasis or, more rarely, at the onset of psoriasis itself. Triggers can vary, from stopping medications like corticosteroids too quickly to stress, infections, or even severe sunburn. In some cases, it's linked to an allergic reaction to psoriasis treatment itself. So, while we can identify these triggers, there's still a big question mark over why this condition manifests so violently in some people and not others. Symptoms, more than just skin deep. When people think of skin conditions, they might imagine dry patches or occasional itching. But erythrodermic psoriasis, it's a full-body assault. The symptoms are not just on your skin, they can affect your entire system. It often starts with severe redness that spreads over most of your body. Skin shedding in large sheets, not flakes like dandruff, but significant, noticeable sheets. Pustules or blisters that add to the overall discomfort. If you've ever had sunburn, you know the sting and heat that comes with it. Now imagine that feeling over almost all of your body. People with erythrodermic psoriasis describe their skin as looking and feeling burnt. It's raw, painful, and constantly itching. And it doesn't stop there. As the body struggles to cope with this inflammation, other issues arise. An increased heart rate as your body fights the stress. Fluctuations in body temperature, often leaving you feeling like you have chills or a fever. Joint pain, swelling, especially around the ankles, and intense fatigue. This isn't just about cosmetic discomfort. The body's chemistry is thrown off balance, which can lead to serious complications if not treated. Why immediate treatment matters. If left untreated, erythrodermic psoriasis can escalate rapidly. The protective barrier of the skin is compromised, and when that happens, infections can slip in. This opens the door to pneumonia, sepsis, and other life-threatening conditions. In fact, studies show that up to 9% of erythrodermic psoriasis cases can result in death. And yet, many people hesitate to seek immediate treatment. Maybe it's denial, or perhaps they're simply unaware of how severe the condition can become. But this is no ordinary rash. You cannot wait it out or let it pass. So, what happens when you do seek help? Treatment, when every second counts. When erythrodermic psoriasis strikes, the first step is often hospitalization. Doctors need to stabilize your body's internal environment, treat any potential infections, and get the inflammation under control. In the most severe cases, fast-acting immunosuppressants, like cyclosporine or infliximab, are the go-to options. These medications are designed to calm down the immune system quickly, preventing further damage to the skin and internal organs. Doctors may also turn to biologics, new medications that target specific genes involved in the immune system's overreaction. For less severe cases, methotrexate or acitretin might be prescribed, either as standalone treatments or in combination with other therapies. Topical treatments, like steroid creams, can help soothe the skin temporarily, though they are often not enough on their own. For people with HIV, treatment options are a bit different. They might require antiretroviral therapy in addition to the standard treatments, as their immune systems are already compromised. Unfortunately, not all treatments work as effectively for those with HIV, adding another layer of complexity. The key takeaway: treatment needs to be fast, targeted, and sustained. This isn't a condition that can be managed with over-the-counter creams or lifestyle changes alone. If you experience symptoms, it's critical to get medical help immediately. Can you prevent it? The reality is, there's no foolproof way to prevent erythrodermic psoriasis. You can't control every trigger, and sometimes, it happens suddenly, without warning. However, for those with psoriasis, there are steps you can take to reduce the risk. First, stick to your prescribed treatment plan. If you've been managing plaque psoriasis with medications, do not stop them abruptly. Your doctor needs to guide any changes to your treatment to avoid triggering a flare-up. Avoid known triggers like alcohol, severe sun exposure, and stress, as these can all worsen your condition. And, as always, be vigilant. If you notice symptoms of erythrodermic psoriasis, don't wait for them to pass. Seek help immediately. The bigger picture. While erythrodermic psoriasis only affects a small percentage of psoriasis patients, it serves as a stark reminder of how serious autoimmune conditions can be. Your skin is more than just an outer layer, it's a protective barrier. When that barrier breaks down, your body becomes vulnerable to all sorts of complications. And here's the thing, even though erythrodermic psoriasis can be life-threatening, it's treatable. With the right medical care, most people can recover from even the most severe flare-ups. But, and this is crucial, timing is everything. The longer you wait, the harder it is to reverse the damage. So, if you or someone you know has psoriasis, take it seriously. Follow your treatment plan, know the warning signs, and always, prioritize your health. Because at the end of the day, your body is the only one you've got and it's worth protecting. Conclusion. Erythrodermic psoriasis is not just a skin condition, it's a full-body alarm telling you that something is seriously wrong. It demands attention, care, and, above all, immediate medical intervention. While it may be rare, it's important to know the signs, understand the risks, and act quickly if you suspect it's happening to you or a loved one. The more we know, the better we can manage it. Don't ignore the signals your body is sending.